pandemic. I'm currently a private practice SLP. I've been at the same private practice. It's like another owner owns it and I work for them, and I've been there since I graduated. But then I do have SLP Literacy Corner, which is a small business that I run on the side. So my website and Instagram and Facebook is all there if you're interested. And I do provide professional development, including group presentations, one-on-one coaching, and I also host an SLP book club for SLPs in like the GTA. And then just a couple of financial disclosures before we get started. So I do provide one-on-one coaching services to students and professionals. The coaching for students mostly focuses on support with applications for graduate school, as well as resume, cover letter, and interview prep. So if you're interested, you can send me an email. I also sell resources on Teachers Pay Teachers, and I am a literacy and SLP consultant for Nom Board Games, which is an accessible gaming company in Toronto. And I am partnered with them for a couple projects, including an alphabet book, which I'm super excited about, and that should be available for purchase later this year. So in today's presentation, we are going to talk about my transition from biochem to SLP, reflections on my academic and career choices, the application process for rehab sciences, education and licensing for becoming an SLP, scope of practice for SLP, continuing education in SLP, and then challenges and rewards of the profession. So I have some bullet point notes here on my career journey, but I also made some notes earlier that I'm going to follow along with on my phone because I can get tangential at times and I don't want to forget kind of what the key points and takeaways were. So I did start my Bachelor of Science in Biochemistry with co-op at the University of Guelph in 2012, and I was part of the Biochemistry Student Association, and I was a peer helper through the peer helper program at what's now the Experiential Learning Hub. It used to be something called something else. And that's kind of where I started my interest in the whole resume, cover letter, job interview stuff. So I really enjoyed my different involvements on campus, and I always look back and think about those as some of my fondest memories and things that I enjoyed. Wasn't necessarily going to all the classes and all the work that came along with that, but all the involvements and friends that I made through that. So another good thing about the program was the co-op. I'm really glad that I did co-op and could try out some different jobs during my undergrad. I did my last 2 co-op terms in molecular and the MCB, molecular and cellular biology labs at the University of Guelph. And the second lab I was in was Dr. Jem Uniac's lab, and it was fantastic. I did my last co-op there. I did a full 4th-year research project there. And then in the future, when I had graduated, I actually worked there full time until my master's program started. So about 6 or 7 months. But basically, I really enjoyed research, and I thought that I wanted to be a prof because then I could teach, which I was always something I wanted to do was be a teacher, but then I could also do research and do the science. So kind of throughout the first few years of my undergrad, that's kind of the direction I thought I was going in. But then in my 4th year, after I'd been in these labs and I loved the people, I loved what we were researching, I was really passionate about going to conferences and poster presentations and presenting and educating others about the research, but I kind of felt like something was missing. I liked the education piece and presenting and talking to other people about it more than kind of doing the hard science in the lab with the cell cultures. And so I started feeling like something was missing, and I just wasn't sure. At this point, I was in 4th year. I did have a bit of extra time, an extra semester because of the co-op. So I technically have 4.5-year degree. But I just wasn't sure what to do with a biochemistry degree at this point if I didn't want to be in a lab anymore. So through the Peer Helper program, I had gotten to know some career advisors, and I did some sessions with an advisor. She did the strong interest inventory with me. And I can't remember if it was like specifically in the results of that inventory, or if she kind of pulled the results of that in her own knowledge, and she recommended speech language pathology to me. And I had literally never heard speech language pathology spoken before. Like I had no idea what it was. And she explained it to me, and it sounded like all the things that I liked, like the education piece, the science piece, the healthcare, all of the things that I was interested in. And I was like amazed. She was connected with a couple speech language pathologists just through circumstance. And so she set up an informational interview for me with an SLP that she knew. And it was like talking to another version of myself almost in a way. We just had so many similarities, shared interests, and I started volunteering at St. Joseph's Health Center and then also a private clinic, Let's Talk Wealth. And I just almost immediately just like loved SLP. Like this was what I had been looking for that I hadn't even known about until someone kind of pointed it out to me. So like I said, I just like loved that SLP combined my interests in science, healthcare, and education. Those were like a big three for me that I was trying to figure out how to combine. And SLP and the rehab sciences in general really do that. So I quickly had to get those prerequisites done. Thank goodness that I was in a co-op and I had that extra semester to work with. And actually, when I did apply, my acceptances were conditional because I still needed to complete a phonetics course online. At the time, back in this would have been 2016, Guelph did not have a phonetics course. So I actually had to take that online through the University of Alberta. So I was applying and then I graduated from Guelph in February, and then the application process, we'll talk about it, kind of like starts in January and then wraps up in like March, April. So I got some acceptances and then went on to start my master's in SLP at the University of Toronto in September of 2017. And I like, again, big on campus involvement. I got involved in the University of Toronto community, specifically like in the Department of Speech Language Pathology as a May month representative. May is Speech and Hearing Month, so it's like a big deal in the SLP community. And I helped some other year 2 students start 2 new initiatives, the Theory to Therapy Graduate Student Conference. So if you ever get into school in SLP, Theory to Therapy is like the annual student conference that started when I was there. And then U of T has a Mind Your Mind program, which is like mental health practice and awareness. And during my time at U of T, I completed placements at Arno Kids, the Peel District School Board, the Toronto Western Hospital, and Toronto Rehab Institute. I always knew that I wanted to work with kids, all like when I was wanting to be a teacher, and then my volunteering was all with kids. So I was stoked about the Arno Kids and the school board placements, but the Toronto hospital scene is like definitely intense. And as someone who knew they wanted to work with children, being there was a pretty big challenge for me mentally and emotionally, but definitely learned so much and have like mad respect for everyone who works at the hospitals, knowing what it's like to work at a hospital. So definitely still cool to have like that experience and knowledge. And then I graduated with my master's in health science in speech language pathology in 2019 and immediately started working in private practice. Literally, we'll talk about this some more too, but there's a 6-month mentorship that you do when you graduate. And the second that was done, like the next day, the COVID pandemic lockdown happened. So we turned virtual. So I guess at that point, silver lining, I was pretty flexible. Like I'd only been in the profession for 6 months. So having to turn fully virtual wasn't virtual wasn't as hard of a pivot as I know it was for some other individuals. But it turns out I actually love working virtual. I did dabble with hybrid once we were allowed to go back and was doing like some days in person, some days virtual, but I've since gone back to virtual full time. And I do love virtual. I see mostly literacy clients, which works well virtually. So it all kind of, found a rhythm that worked for me in the end. And then I started SLP Literacy Corner in 2022 to share my knowledge and passion for literacy with others. And I definitely still do a lot of continuing education, which we will talk more about. So that's a bit of an overview of my career journey, just kind of to give you a bit of a background on myself and that transition from biochem to SLP. This actually recently came up on my Instagram as well, like a whole bunch of people in the field, other like Instagram SLPs that I follow are kind of sharing their transition into the field or how they got into the field. So I jumped on board with that. So if you're interested, there's a post there that talks more about my transition from biochem to SLP. And then there's some stories in my highlights that kind of went along with that, and I answered some more questions. So just a reflection on my own career choices, academic choices. Is biochem the best choice for an undergrad before going into SLP? Maybe not. Although hilariously, in my U of T class, we were the first class of 60. They had upped it to 60. I think it's gone up a bit more since. But in my class of 60, there was 3 of us that had a biochemistry undergraduate, which the 3 of us had a good laugh at because it seems pretty random. But it did work out for me. It worked out for those 2 individuals as well. They're both still SLPs. And would I choose it again, biochem as my undergrad? Absolutely yes. I actually enjoyed my undergrad a lot. I loved being part of the Biochemistry Student Association. I made lifelong friends. So if I had to do it again, I definitely still would choose it. That being said, some undergrads that might make more sense. There was like a lot of linguistics, psych backgrounds in my program. Some schools do have like a SLP undergrad, like U of T does have one. So there definitely may be some things that align better, but at the end of the day, we'll go through the requirements and you see that like you still need a 4-year bachelor's degree in order to apply to the master's and then certain prerequisites. So biochem still met kind of like the baseline. And then I just had to tack on some of the prereqs that were missing because they just weren't part of the biochemistry, electives and classes that you would take for biochem. Was the University of Toronto the best choice for SLP? For me, I believe that it was. I was accepted at Western and U of T and ended up going to U of T. I was really wanting to live in Toronto actually for a few years and be near all of those hospitals and kind of have that experience in that environment. So I stick with that decision that I made as well. As far as career choices that I've made so far, was private practice the best choice for me? I think definitely. We'll talk some more about this as well, but private practice is so wonderfully flexible, and you just kind of have a lot of say in your caseload and just a lot more choice overall. And I think that suits me as an individual. And then starting a small business, I think, has opened up a lot of doors and opportunities for me as well. This partnership with Omnivore Games and getting this alphabet book out. If I kind of just maybe had just stayed with private practice and kind of just stuck with that, some of these opportunities that have come to me because of starting SLP Literacy Corner might not be a thing. So really what I want you to see, the takeaway here is following your interests, follow kind of that gut intuition and trust that you'll choose what's right for you and just follow that path. And I chose biochemistry when I was in grade 12, making the decision for undergrad. That seemed like the best choice at the time for me. And then as I went along, my interests and what I was looking for were kind of evolving. And I changed my path to align with that. So I think just ultimately following your interests, you know, going where the path leads you and making that best decision for you at the time. So diving a bit here into the SLP programs and applications a bit more. This is the curriculum overview from U of T. So another thing to consider when you start looking into like the rehab sciences and then niche down into like one of them, for instance, SLP, looking at the different schools that have an SLP program and what their curriculum looks like, because all of the schools in Canada will get you the requirements that you need to apply for your license. But their setup is a little bit different and their program offerings will be slightly different. So one thing I liked about U of T, I don't know if this like is still true, but at the time, some of the other schools had, you'd have placement and you'd have class. So in the same semester, you might be juggling some classes and placement that might be either a couple of times a week, or maybe it was like a half-day situation, whatever the case may be, there was a bit of balance there. U of T is not like that. You have like in-class work terms, and then you have placement, clinical placement terms. So I really liked that separation for me personally. They also have it so that year one is a lot of the like pediatrics. You get like the audiology kind of in there. And then the second year was more getting into like aphasia and some of the conditions and things that we look into with more of like an aging population or like that hospital setting, like adult to aging. So I really liked the way the program was set up for me personally. So I've got links on all of these slides too. I'm not sure if the handouts went out, but I can drop them in the chat also when we're done here. I just don't have access to the chat right now. But I did make handouts. I will make sure those get to you somehow. And all of the links that are on this presentation are clickable links in those handouts. So then just discussing these rehab science applications a little bit further, you can apply to all of the programs here through the Ontario Rehabilitation Sciences Programs Application Service, which is ORPAS. So speech language pathology, audiology, occupational therapy, and physical therapy or physiotherapy. And then on ORPAS, they have the list of the universities in Ontario where you can, and again, this is linked here at the bottom so that you can go there and you can click each of those links and it'll take you to that school's page. So like, for example, the McMaster School of Rehabilitation Sciences, and you can click through and see each one. U of T and Western kind of break things down by department. So each one's kind of on its separate page there. But if you're looking into like, how the curriculum is laid out and what the courses are like and the placement setups and that kind of thing, it'll help to compare and contrast some of the different universities. They do also kind of like have different perks, right? Like U of T, you're right downtown, you're like UHN is like a huge like network of hospitals, and like getting into those is a big deal for some people. Western, because it has an audiology program as well, Western has like an in-house audiology clinic. So that's a really cool opportunity. In Toronto, we had to get our audiology hours like through other clinics and on placements and doing all these things. But a lot of the Western, like the audiology hours you would get in SLP would be at that in-house clinic. So definitely different opportunities to be had at the different schools and worth exploring what those opportunities look like for each. So when you go to apply, every program is different, but applications typically include, and again, each school is slightly different. There is completion of specific prerequisite courses. There's a minimum academic requirement. So the kind of general is a 4-year undergraduate degree with a minimum of a B average, and ORPAS has their scale there. In the 10 most recent full year courses, so if Guelph is still the same, those would be like your 1.00 credit, or 20 half-year courses, which would be like your 0.5 course. You need a statement of intent, and then references. Some of them are academic, some of them are clinical. Some schools ask for both. McMaster is a little bit different in that they let you apply, and then they basically have a cutoff of some kind of average that's basically determined on the applicants for that year. And everybody above that average gets on to like the next stage in the application. And if you don't meet the average that year, unfortunately, you don't move further with the application process. So some of the schools, it does vary, but this is like the typical what to expect. And again, there's like a program requirements page that outlines the requirements for each of the specific schools. And then this is what the kind of application timeline looks like. So January 6th is the deadline for applications. January 30th, like you have to put in the transcripts. In June, they have to have received all like your transcripts from like the spring semester. And then SLP and audiology offers get sent out a little bit earlier than OT and PT. That does vary slightly every year, but that's kind of like the general timeline. That's what things looked like this year as far as when applications were due and when offers were going out. And again, some of these offers can be conditional. So for myself, when I got my offers on April 1st, I actually think it was like the end of March that year, they were conditional. I hadn't taken the phonetics course yet, but I had registered to take it through the University of Alberta. So I basically, in my application, like I had my student number, I had the course, like they knew that I was registered. I got my acceptances, or my offers, I should say. They were conditional on me needing to get, I forget, whatever the average was, probably the same kind of like B in that. So even though I got offers and I accepted it, it was conditional until like it was a pretty close call because I would have taken it in the summer. And then school started in September. So at that point, you're kind of working one-on-one with the school to make sure that you're submitting everything that you need to submit and that you do meet all of the conditions required to make that an official offer. So if you're kind of, you know, in a space where you might be trying to sneak stuff in at the last minute, it can be done. And then as far as the licensing process is concerned, so like, you know, you got in, you're doing your degree, and you're kind of thinking about after you graduate what the licensing looks like. All the rehab sciences are regulated healthcare professions, so they do have a license that you have to maintain to be able to continue practicing. So to practice in Ontario specifically, as an audiologist or speech-language pathologist, you have to be registered with the College of Audiologists and Speech-Language Pathologists of Ontario. CASLPO is what we say. There's 4 pathways to CASLPO registration. I've got them listed there. Links are at the bottom as well. Basically, if you go to a school in Canada, like a master's program for one of those, like the ones we listed on ORPAS, you would be going through the Canadian accredited program kind of pathway to be registered. So all of the schools in Canada and Ontario meet those requirements, like, you know, a certain number of hours and a certain number of courses and kind of just like the baseline. So then when you are going to apply for your license, you have to read through this application guide. You get access to the registrant portal to begin your online application. It's pretty straightforward. There's nothing too crazy in it. You basically need to prove that you can work in Canada, submit all the official university transcripts from your master's. Like that part's pretty easy. The extra layer that got added recently was that you need to enroll in and complete the Canadian Entry to Practice exam through Speech Language and Audiology Canada, SAC. So that Entry to Practice exam is relatively new. They tried to roll it out, but then COVID got in the way, and it took a little bit. So I think we're only on year 2 or 3 of this being in place. But again, I have links here so that you can investigate that further, but this is now a requirement for all SLPs in Canada, which isn't uncommon. Like nursing and other professions kind of have an entry to practice exam. So I'm not surprised that this got added, just to kind of make sure everyone's at that same level. And then after a review period, CastlePo will confirm your registration by email. You basically just get a license number and then you're good to go. And then, like I kind of mentioned at the beginning of the presentation, there's this 6-month mentorship period. In Ontario, that's a requirement for initial registrants when you first register. So before you begin your mentorship, you have to secure an offer of employment. You have to have somewhere to work as an SLP. The good news is SLPs are in high demand. So there's lots and lots of job opportunity out there, which is fantastic because the job market can be pretty tough in some other professions. So you secure an offer of employment, you find a mentor. Typically, there's mentors at your place of employment. There's just certain requirements they have to meet with years that they've practiced, and they have to be in good standing, and just some kind of basic stuff. Now, if you can't find one at your place of employment, that's also not a problem, because SLPs who work in private practice or SLPs who work like in the school board, they also can volunteer to be a mentor. So you can still find somebody who's available to mentor you. Preferably, like if you're in private practice, you would want a mentor who's in private practice, because they would kind of get that. And, you know, if you're in a school board, you'd want a school board mentor. But I digress. And then the other thing is that you need to be registered to practice. So you have to wait till you get that CastlePo registration number, your license number. So you have your offer of employment, you have a mentor, you have your registration number, you're ready to go. And then you start your CastlePo mentorship. So this isn't it isn't like a placement. It isn't some extra thing you have to do first. Like, it's essentially your full-time job practicing as an SLP, but you're just overseen by a mentor, just to make sure that you are following the CastlePo guidelines, that you're transitioning into the career, that you have someone to ask questions to, so they don't just kind of throw you into the role, essentially. So this isn't some like crazy extra thing or a pre thing. Like, you would be getting paid whatever the agreed upon amount is. It's just a mentorship for the beginning 6 months. Basically, you get guidance from the general CastlePo registrant. You complete, during that 6 months, you do have to complete 500 hours of patient care, which is like pretty easy to do in 6 months. If you think like you're working like 30 to 40 hours a week, like you end up going over the 500 hours of patient care. It involves direct observation from the mentor. So if possible, they'll be sitting in with you in your sessions just to kind of see how you're doing, provide feedback, be there for guidance and support. There's a clinical reasoning tool that you do at the midterm. And then there's a progress report that's submitted by the mentor. And the other reason for this mentorship is every year we have to do an SLP to keep our license, like a yearly self-assessment. So this mentorship also introduces you to that self-assessment tool, the different standards of our profession, and the things we need to do to uphold those standards. So in a way, it's kind of just easing you into the profession and the things you're going to have to do for the rest of your career. So moving on to the scope of practice, SLP has a very broad scope of practice. There's a running joke about how like speech language pathology doesn't capture all the things we do, but like speech language, literacy, fluency, AAC, cognition, but like it has all these dashes, like still wouldn't capture what this profession does. So just a general kind of overview, some things SLPs work on include speech sound production, expressive and receptive language, voice and resonance, fluency, literacy, which is my jam, swallowing and feeding, social communication, cognition, and AAC, which is alternative and augmentative communication. So this is just pulled off of the SAC website, but clinical practice includes assessment, treatment, and consultation services for long list that I kind of summarized on the previous slide, but so many different areas, which is another reason that I think SLP is a fantastic field, because you'll find something there that really speaks to you, that you can niche down if you want to niche down. Or if you're someone who loves variety and you just want to like learn all the things, see all the things, that is an option as well. There's a lot that SLPs can do. So whether you kind of want to niche down or stay general, you can do either. The roles and responsibilities are prevention of challenges on the previous slide, promotion and advocacy for those things, education and research, and administration. Practice settings is also so varied. So I'm in private practice, but that's just one of the many, many places that SLPs provide their services. So again, tons of opportunity for just like different settings that you can work in. Public sector, private sector, government, schools, there's SLP job opportunities in lots of varied settings. And then to continue in SLP, to kind of uphold our license, we do have to perform or engage in, I should say, continuing education. So in Ontario through CASLPO, it's called Continuous Learning Activity Credits, or CLACs, which are an essential component of the CASLPO Quality Assurance Program. And we document them annually in our self-assessment tool. So the joke is they always send this on like New Year's Day, and it's like, Happy New Year. Go fill out your self-assessment tool from like 2024, in this case it was, whatever the previous year. It's kind of more paperwork than anything, but it is quite straightforward. Basically, every calendar year, you establish 3 learning goals for that year, and then you have to obtain 15 CLACs, which is basically 15 hours of continuing education. And you can get these 15 hours, and this is like 15 hours over the whole year. So not anything like insurmountable. They also accept pretty much everything. Group learning activities, which is like going to conferences, presentations, workshops, independent learning activities like reading professional journal articles or books. They've added podcasts to the list of accepted continuing education. So, I mean, 15 hours of podcasts is nothing if you listen to podcasts. So tons of continuing education out there, which makes sense, one, to uphold the license and just like the standard that we hold ourselves to. But also you saw that list of the scope of practice and the different things that SLPs can work with. If you're niching down into one of those areas, then you do want to continue to get more education and to keep current with like the research, the best practices, all of that in that area. I definitely gobble up literacy continuing education and take new trainings and keep up with the journal articles. So I always have well over 15 hours of continuing education just for my one literacy goal at the end of the year. So very easy to do. U of T had a thing about how in speech language pathology, you have to be a lifelong learner. And that is definitely the case. If you like learning, there is always a lot to learn. And I personally really enjoy learning and nerding out about stuff. So picked the right profession for me. The last thing that I wanted to cover, it was recommended that we end with challenges and rewards of the profession. So because I do have an Instagram community, I thought it would be really fun to not just give you my perspective, but I polled my audience, put up little question boxes for things they felt were challenging in SLP, and then another box for rewards. So these are things that I pulled from there, but in my Instagram, on my highlights page, I do have a biochem to SLP highlight, and then I tacked these on all of everybody's answers because there was more than I could fit in the 2 pages. I tacked everyone's answer on in those highlights, so they are saved, and I think it's fun to look back on. So overall, biggest challenges people mentioned were the emotional burden of a giving profession, which I think is huge in healthcare and education, all these different giving professions. So that definitely needs to be acknowledged, that there is that weight of helping individuals who really, really need this help. And we do feel that burden of the constant giving and helping. It can weigh on some people more than others, but it's definitely not to be dismissed. Our scope, regardless of setting, can overlap with many different professions. So many may not view us as needed or important. I thought this was a really interesting comment. There's a lot of that in SLP with overlapping scope. For example, occupational therapy kind of delves into some of the same things we do, especially on the feeding, swallowing, cognition side. So sometimes it can be hard to know which professional is needed and who's responsible for what. With me being on the literacy side, that is also challenging because teachers are often seen as like the literacy experts, but they too are a generalist in their area in a lot of cases. And I do think that I'm a firm believer in collaborating with other professions and there being room at the table for everybody to support a child in need or an individual, regardless of how old they are. And everyone bringing in their different profession, their different professional lens and seeing things from an SLP perspective, an OT perspective, the teacher's perspective. I think that they're all to be valued, but yeah, sometimes, especially when you're in a field like what's a speech language pathologist or what's an occupational therapist, sometimes if people don't know those job titles, you definitely can get that feeling of like no one knows who we are or what we do, let alone how important we are. High caseloads, regardless of setting, and a lack of upward mobility. There isn't a lot of climbing that job ladder in SLP, potentially a little bit more in the public sector and school board jobs. Usually after a certain number of years, your vacation days or pay or whatever may get reevaluated. Or you could move up in administrative roles. Like there's some upward mobility, but I wouldn't say it's as much of like that climbing the ladder that you kind of get in some other careers. In the public setting, there is a lot of bureaucracy, red tape, a lack of funding, atrociously long wait lists for public services that have just gotten worse since the pandemic. So dealing with all of that can definitely be challenging. In the private setting, when you work in private practice, for example, I'm an independent contractor, there's no benefits, there's no paid time off. You get paid when you see clients. If you don't see clients, you don't get paid. We also have to deal directly with payments and collecting payments from our clients, which some people can feel a little bit uncomfortable with or challenging when your clients start to fall behind in payments or credit cards aren't going through, whatever the case may be. So there's a little bit of extra involved there. And then feeling bad that only people with financial means and or benefits can afford private services. That always hits really hard for me. A lot of my families that end services, it's because their insurance coverage has run out and they simply can't afford the private practice sessions without insurance, which is completely understandable, but you do feel bad because you're discharging this kid who needs continued support, but the family just can't afford it right now. But we'll end on some rewards of the profession. And there were a lot more of these than challenges in those boxes, which was nice to see. So overall, an ability to work across the lifespan in different areas. You can work in so many settings, ages, and populations, helping people achieve their goals, being able to truly make a difference in a person's life, building strong relationships with clients, families, and professionals, collaborating with different professionals. You can be an entrepreneur and build your own business if you want. That goes for anything from starting your own private practice to doing little like one-off side projects like resource creation is very common and something that I do. The coaching and presentations, there's definitely a lot of entrepreneurial opportunities. And then in private settings, some of the things that were specifically mentioned as rewards of private were the potential to be the highest paying SLP job opportunity. So you kind of balance that risk versus reward. You only get paid when you see clients, but the more clients you see, the more pay you receive. So easy to make more money as needed and then scale back if your priorities kind of change in life and you need some more downtime. And then choosing your own work hours and service areas in private practice, I think, is a huge one. Definitely something that I personally really enjoy about private practice is that sense of kind of complete control over my work hours when I work, kind of the caseload that I see, although my boss personally in the private practice does have a final say in that. So to summarize, and I have left 15 minutes for questions, so that's fantastic. Our key takeaways from today, we discussed my personal transition into speech-language pathology, reflections on my academic and career choices, which I think the takeaway there was really, you can see, just following interest along the way, follow your interest, follow your gut, follow the things that you're curious about, and just make the best decision you can for yourself at that time and reevaluate and continue to follow different paths as needed. The application process for rehab science programs is all through ORPAS. ORPAS has links that can take you to each university's pages that kind of outline both the requirements and the curriculum for the different programs. Definitely worth exploring all of your options and, pick some favorites, but apply to as many as you can to increase your chances, as always. The education and licensing process for becoming an SLP, it is like all laid out to you clearly while you're in school as well, which is really nice as far as like licensing and what to do next. And of course, when you graduate, you're going through that process with your peers who are graduating alongside you. Scope of practice for SLP is beautifully broad, allows for you to explore different areas and stay general if you want, or to niche down in certain areas that really pull your interest and passion. Continuing education in SLP is a requirement, but is also just a great way to continue learning and following your interest. And then, as with every profession, there's some challenges and rewards. I like to think that the rewards outweigh the challenges, but that does vary from person to person and setting to setting. All right, so that's it for the main presentation. So we will go with questions that anybody has now.
Okay, if you have any questions, feel free to type it in the chat or even unmute yourself.
I think I've stopped sharing.
Yeah.
Perfect.
I think we did have a question actually in the form that someone, oh, okay, I think someone just asked a question. Do you want to go ahead and answer that and I can type the next one?
Sure, I'll just I'll answer it out loud. So I'll read it out loud for anyone who can't see the chat. You mentioned doing an extra semester / co-op. Do you know if admissions typically care if your last / usual course loads are 3 to 4 out of 5 courses, or are they always 4 to 5? So like admissions at the master's programs is what I'm assuming that you're talking about. They, to my knowledge, aren't looking at the course load. They just look at that past, I think it was kind of like the 20 half credits or 10 full credits, like whatever makes up that amount of courses, that's how far back they're looking. They'll be able to see, if you only took 3 at a time. But I don't think that should matter. You're welcome.
And then we had a question that someone asked, saying, how many hours of shadowing or volunteering did you have prior to applying?
Oh, good question. Um, Off the top of my head, I can't remember. It wouldn't have been a ton because, well, I probably would have only been applying for or like volunteering for 6-ish months before I had to submit my application. So it wouldn't have been a lot. I did stay on volunteering at those places after the applications went in, just out of pure interest and wanting to continue learning before I went into the master's program. But they have also waived the volunteering in a lot of cases. During COVID, it basically was impossible to get the volunteering hours that you needed to apply to the rehab science programs. So in a lot of the cases, the volunteering got completely waived for several years, and some of them haven't put it back. So some of them have put it in almost like an optional section on the application that you can put in whatever your volunteering hours are, but they're not a requirement for every program anymore. I can't remember how many hours used to be the requirement. Someone's got their hand up. You can go for it.
Hi, I was just wondering what your GPA was when you applied in your fourth year and your third year, because I know a lot of schools require you to have over like a 3.3 based on, I think it's at the OUAC scale, the conversion table. So yeah, I was just wondering what your GPA was.
Um, that is another really good question. I believe, I don't remember what the scale conversion ended up being, but it was in the low 90s when it was just the courses, like somewhere in the ballpark of 90 to 92 for that last set of however, like the courses that they were looking at.
Thank you so much.
You're welcome. That is just one part of the application. MAC is the school that's going to look at that the most because they set the kind of cutoff at some point that varies depending, like year to year, based on the applicants. But then other schools will kind of take that with all of the other pieces of the application and are looking for a well-rounded student, whereas MAC's looking at that as your cutoff, and then other people will carry on to the interview process.
Okay. I had a question. So, a lot of students that apply to grad school and then don't necessarily get in on their first try. What would your advice be for students that still want to reapply and like in terms of it kind of making themselves a better candidate the next time around? Like, do you think like more clinical experience would be helpful or maybe like doing an additional year of undergrad?
That's a really good question. So there were several individuals in my year that were faced with that challenge. Some individuals just reapplied again the next year, and I don't know what changed, but they did get in the second time. And then I do know a couple of people who did not get into SLP on their first attempt. So they took the communicative disorders assistant college level program. It's 1 year. A CDA is basically, so in the States, they call them like SLPA. You're like the SLP's assistant. In Canada, we do CDA, and you are trained to be an audiology or SLP assistant. So some of them went and did that for a year so that you're like getting more practical knowledge, you're getting more content knowledge. You do get training and the prereqs that you need to get a CDA job. And then they kind of reapplied to SLP because they did kind of want that next step. The CDA cannot do assessment like an SLP. They can only take an SLP's assessment and treatment plan goals and carry out the intervention piece. So there's not as much room for growth in CDA as there is for SLP, but nevertheless, still definitely a good option. And also one way that you can kind of take a 1-year program if you really want to apply to SLP the next year. And OT and PT do have a similar situation where there's like a 1-year college level. If you graduate from that, you do all the requirements, you would be like at the assistant level. So still would be a job opportunity, good experience, and then something else to put in those applications if you wanted the master's.
Sounds good. Thank you.
You're welcome.
Anyone have any other questions?
I do have a question for you as well. Looking back, is there anything you wish you knew before going into this career?
That's a good one. I think I found out about it late. I think really if I could change anything, I wish somehow I would have known about it before 4th year of my undergrad. But I kind of just stayed with an open mind and have followed what my interests have been along the way. I don't know, if I could go back and meet my younger self and give them a heads up about something, I don't know what I would say. I think everything's kind of worked out okay, like following the path where it led me. It is interesting that I work virtually full-time as a speech language pathologist. That's a plot twist I didn't see coming, and that it works and that I like it better than being in person, which is partly why I chose this career, is to be in person working with people all the time. So that might be something like, maybe I would have prepared differently somehow, although I'm not sure how. I don't know if that really helps, but I don't have a definite answer for that one. Sorry.
Okay, and we have Ashley who has, feel free to unmute.
Yeah, so I was just wondering, I've looked at the CDA and I was curious if there's similar prerequisites to the SLP, or if there's a page that you can see if there's like specific classes you have to take to get there.
That's a fantastic question. I assume similar prerequisites, but your best bet would be looking at the schools, because the colleges aren't using ORPAS, but they might be using some other kind of branch of the UAC. I'm not entirely sure how the college level applications work, but for instance, I'm trying to think of like a school off the top of my head that does CDA, but I can't think of one.
I think there's one in Barrie, like Georgian College.
That sounds right. There should be one in Toronto area as well. Like Ryerson or York, something. I think Ryerson's name changed, but I forget. But looking at the school, they will have to have their prerequisites listed. They shouldn't be too far off from SLP, considering that people that I know have applied to SLP, didn't get in, and then went to CDA. I assume that there's not an incredible amount of variation.
Okay, thank you so much.
You're welcome.
Okay, last call for questions. And just a note that this session is being recorded, so we will definitely email that to you, and it'll also be up on our website. And then also the handout that Brianna was talking about earlier was also emailed to you as well. But if you, if any of the links end up not working or anything like that, definitely let us know and we can look into that.
Perfect. And then my Instagram is there in the chat. Feel free to follow, send a message if you're comfortable sending a message there. If not, I also have an email, but I find that people tend to use social media. SLP Literacy Corner.com. So if you have any more questions that come up and you'd like to chat, or you're interested in some more in-depth one-on-one coaching as you move forward with applications, feel free to reach out.
Okay, perfect. Well, thanks everyone for coming. It's almost 7:45, so we'll end it here. But yeah, feel free to reach out to either Brianna or us if you have any questions at all.
Perfect. Thanks so much for hosting. Thanks for having me.
Thanks, Brianna.